in the throes of an opioid epidemic. Over 130 people die from opioid-related overdoses every day in America. So what are opioids? They're drugs that chemically bind to specific proteins called opioid receptors in the pleasure centers of the brain, and they intensify emotions by releasing the hormone dopamine. They were developed for pain management but are highly addictive. The prescription opioids include oxycodone, hydrocodone, codeine, and morphine, which are prescribed by physicians for pain management. Illegal opioids include heroin and illicitly made fentanyl. IMF is a synthetic opioid that was originally contrived for surgery anesthesia. It's 100 times stronger than morphine. A brief history of opioids starts back in the 1960s, where Civil War soldiers were treated with morphine for their pain. Many developed dependencies as a result. Then Bayer Co. created the wonder drug heroin to relieve pain. There were not many pain-alleviating options at the time, and little research was known about heroin yet. It did become illegal in 1924 when doctors realized the fully addictive properties of opioids. Then Percocet and Vicodin were released in the 1970s. However, physicians rarely prescribed these drugs as they were aware of their addictive qualities. Jane Porter and Dr. Herschel Jick released a publication in 1980 regarding a research study that they conducted. They declared that less than 1% of hospital patients in the study who were treated with narcotics developed an addiction. Since there were no other trials to discount these findings, the following decade, Purdue Pharma introduced extended-release oxycodone to the market and labeled the drug as abuse-resistant. The pill was intended to minimize the euphoric effects. However, people began to crush the pills and snort them or inject them to circumvent the time delay. Oxycodone prescriptions increased from 670,000 in 1997 to 6.2 million in 2002. The prescriptions peaked in 2012 at 282 million, and in 2017, 2.1 million people had an opioid use disorder. So how do we solve this? Long-term medication treatment drugs are used to combat and manage opioid use disorder. There's methadone, buprenorphine, and extended-use naltrexone. Methadone is a full opioid agonist that generates a similar euphoric effect but limits the ceiling of stimulation. Buprenorphine is a partial agonist that generates a limited effect and can be prescribed by a physician that has received training and certification from the DEA. Then extended-release naltrexone is a full agonist and must be taken after being sober for 1 to 2 weeks, but can be prescribed by any health insurance provider. In substance use treatment facilities in 2016, only 6.1% of them offered all 3 medication treatments. 2/3 of facilities didn't offer any. So looking at the treatment policy, the Reauthorization Act of 2006 increased the accessibility to medication treatment by increasing the number of buprenorphine patients that primary care physicians were authorized to treat from 30 to 100. This was huge. Then the Affordable Care Act of 2010 expanded Medicaid and insurance coverage, required substance use disorder treatment coverage in existing insurance plans, and extended parity protection of the Essential Health Benefits Package established in the Mental Health Parity Addiction Equity Act of 2008. So going into the study of health affairs, researchers in this academic article, Medical Treatment for Opioid Use Disorder in Substance Use Treatment Facilities, sought to identify and define characteristics of faculty and state-level substance abuse treatment facilities that offer medication treatment for opioid use disorder. They used data trends from the National Survey of Substance Abuse Treatment Services over the 2007 to 2016 time period. So the first analysis looks at outpatient facilities offering medication treatment. The data shows that outpatient services offering any medication treatment increased from 20% in 2007 to 36.1% in 2016. Outpatient facilities that offered buprenorphine rose from 14.9% to 25.4%. The data supports that the Act of 2006 was a successful policy in increasing access to medication treatment. The next analysis, data was compared across various facility characteristics such as the type of operating agency, whether or not the facility was located near or operated by a hospital, inpatient services, the size of the facility, and so on. The data revealed significant disparities in operating organizations. At a federal level, the Department of Veteran Affairs was 12.36 more likely to offer medication treatment than a private for-profit organization. Facilities located or operated by a hospital were more likely to offer medication treatment than those not. Facilities that accepted Medicaid, state-sponsored insurance, private insurance, and cash or self-payment were found more likely to offer medication treatment than those not accepting those payment forms, such as facilities that receive federal, state, country, or local funds. Additionally, facilities that provided free treatment to all their patients were less likely to offer medication treatment. The final unadjusted logistic regression analysis by the researchers dissected the association of outpatient substance use disorder facilities that offered medication treatment and state-level variables. The analyzed data included the expanded eligibility of Medicaid for both facilities that accepted Medicaid and those that did not, and the number of medication treatments covered by the state's Medicaid programs. The data revealed that for each additional Medicaid treatment covered under the state's Medicaid program led to a 44% higher odds of offering medication treatment overall and 52% higher odds among facilities accepting Medicaid. In Medicaid expansion states, facility location correlated with 89% higher odds of offering medication treatment for facilities accepting Medicaid. The data corroborated the premise that facility location in a Medicaid expansion state remains a significant predictor of facilities offering medication treatment and accepting Medicaid. Thank you.